Hi, and welcome to a special episode of our Experiencing Consciousness podcast. We are
Roxanna Erickson,
Catherine Rossi.
and I'm Jan Lipa.
We are so happy you are here.
Hi, and welcome to another episode of our podcast. Today we are here with Dr. Roxanna Erickson and Dr. Catherine Rossi. And today we're going to be talking about the utilization approach, and we're going to be specially speaking about the utilization of the most pathological aspects of the client's behavior. What do you think about that?
I think that calls for a contrast with many people's understanding of what utilization is all about. So many times people interpret utilization as finding a strength and going with those good qualities and drawing out the strength, amplifying it. But the way my dad, Milton Erickson, utilized the client's tendencies is he approached it from the back door, and he would look at all of the things, the environment, the strengths, the weaknesses, the healthy parts of the individual and the unhealthy parts.
I think it's really important as that, to me, my understanding of utilization is you use what's in front of you. And so as you're noticing it, and as you're noticing the total, as Erickson would say, you have to look at the whole patient. You don't just look at what the diagnosis is, that if a person has a broken arm, you also notice how they walk and how they talk. And so that there's a real talent to be able to look at the whole person. And while I'm an extraordinarily positive person, that is not what I'm looking for when I'm sitting down with a client, because that's not what they need help with, in my opinion. They need help with whatever this problem it is that's coming in front of them. And if they could solve the problem, if they could come to peace without me, they would do it. And so we need to have the courage to go into a person's way of thinking, a person's way of being, the way that they interact with other people. And sometimes that even requires a diagnosis. And sometimes the diagnosis is, in fact, pathological. A pathological diagnosis. Maybe the person suffers from schizophrenia, for instance, but they don't realize that they're not seeing the world the way that others see it around them. And they find that it's comforting to be able to face whatever it is, that pathology. In today's world, we don't talk about neurosis much anymore. It used to be so popular. And neurosis is like kind of natural and normal, and but it's seeing the world in a slightly different way. Neurosis, you're seeing stuff that isn't there. But so I think that as we explore this, it opens up this possibility really to see the whole person. And that's one of the big things I learned from Erickson.
The whole person with everything. And even with the things that are perceived, and I say that purposefully, as the most difficult, most pathological, most frightening to people, you can somehow utilize them in a process. So let me just bring to the discussion a little quote from Dr. Erickson himself, how he actually states what the utilization is in terms of therapy and hypnosis. And this is a quote from an article, from a paper called Further Clinical Techniques of Hypnosis, Utilization Techniques. And it's an article from the American Journal of Clinical Hypnosis from 1959. And he actually, what he states in this article, part of what he states about utilization technique is, to quote, "These techniques are in essence no more than a simple reversal of the usual procedure of inducing hypnosis. Ordinarily, trance induction is based upon securing from the patients some form of initial acceptance and cooperation with the operator. In techniques of utilization, the usual procedure is reversed to an initial acceptance of the patient's presenting behaviors and a ready cooperation by the operator, however seemingly adverse the presenting behaviors may appear to be in a clinical situation." So what this acceptance means and what this utilization means and what does it mean? Well, what do we do with this adverse behavior? You know, so many questions that I can actually ask at the same time.
Well, one of Erickson's most famous examples for utilizing pathology is that in a mental hospital, there was a patient that was proclaiming to be Jesus Christ. And so my father called him in and accepted that, you know, I hear you identify yourself as Jesus Christ. Do you have carpentry skills? And then went on with this inmate of the mental hospital to encourage him to develop his carpentry skills, which he saw as totally congruent with his existent identity as Jesus Christ.
So he kind of went, Dr. Erickson kind of went into the world of this person, and so in the understanding of his own situation and who he is, possibilities that he then utilized to develop useful skills that were that helped that client somehow to I don't know, become more self, sufficient, or kind of that he was able to manage his life a bit better. Do I understand that correctly?
Yes, well, he was able to contribute to the social environment in a more effective way. But what Erickson did was he just skipped past that questioning of, are you really, that doesn't make sense to me, or people are challenging it. He just skipped right past that and went on with full acceptance. You self-identify as Jesus Christ. Okay, and he too accepted that and went on into cooperation and utilization of that pre-existent identity.
It is pretty interesting. And before I knew about Erickson, I did work in research, but at a mental hospital. And, every so often, a patient would come in and you'd ask them, well, what is your name? Pretty innocent question, right? Well, when it's, well, I'm Jesus Christ, I'm Buddha, I'm, Muhammad, I'm, naming all of them in a really fast order. And my response to them was, well, you must be a really interesting person.
Mhm.
And so instead of, well, what are you talking about? You can't be that. And there was one that then he did these various things with his hand. And I said, well, and what are you doing now? He said, well, I'm parting the Red Sea. I said, oh, that's thousands of miles away, isn't it? Well, that's going to be on the news tonight because that's a really big deal. So we can actually tune on to the news tonight and we could see, are you Moses? Can you actually do that? And he said, that's right. We can look at the news tonight and verify. And so it was not contradicting anything that he said. And of course, when you're knowing that this is psychosis in front of you, that in my question becomes, how do you deal with it in the kindest possible way? Because that's not what society is going to do. Society is going to say, oh, you're really crazy. You're out of your mind. Your name is John, or, that sort of thing. And, but I do remember the story of Erickson saying, oh, well, how are your carpentry skills? And, the idea of being able to embrace, but also distract really from the psychosis to give him something really practical to do, that will contribute with society, but also, focusing his mind on his hands, focusing, the 3D of building something. And then it becomes positive. To me, this is where the positiveness comes in, that for a person to be able to accept themselves when they're really having pathology is very difficult. And so for them to be able to at least be interested in their pathology and not like fighting it or not trying to prove it, opens up the door for their minds to expand and to maybe go into other places where there is a consensual reality with it.
Well, actually, you mentioned so many important things here, but you also mentioned the positive side, and that's actually that opens to me quite an important distinction, because many people actually misinterpret or mix together utilization approach with the approach that Martin Seligman proposes with his positive psychology, where he says looking for strengths within people is very important, which is, but there's a, so what I met here in Poland sometimes is the accusation for people using utilization approach that they are kind of missing the important part of pathology in people, that they are in a kind of omitting it, saying that we're looking for strengths, this is not important. But the difference between the positive psychology, from what I understand, and utilization approach is, do I understand that correctly, that it actually includes the pathology in such a way that it, but what it does, it sees in it the opportunity, some kind of abilities that will help the client properly utilized to achieve their goals in some way. What do you think about it, and can we actually build upon that even a bit more?
I have an example of my own that comes to mind. And that was a fellow who had been referred to me, and for very severe childhood trauma. He was repeatedly beaten and not, not parented in a healthy way. And he was referred to me by a very, very excellent EMDR therapist who had not been able to facilitate his movement beyond this fixation with incidents in his past. And when he came to me, and he was a fully grown adult, I think he was about in his 30s when he came to see me. And when I asked him what he was here for, he again explained he was here because his parents had both, mistreated him so severely. And he wanted to tell me about one particular incident. And the incident was that his father was a machinist, and they had a machine shop in the basement of their home. And he was a kid, and he was down there, and he started the machine and got pinned on the machine. And so he was telling me about this, and he got trapped in the machinery in a posture that was as if he was being crucified. And so as he described this to me, I was listening to him telling the story, and the way he described I was crucified and left there to hang on the machinery for an extended period of time. And then he paused, and you could see that it was just going into that image in a very troubled way. And so I essentially joined him and said, I am so happy that you were resurrected and now find yourself here in my office where we can explore your future. And the way he responded to me, it was as if this was the first moment he had ever considered that he had been resurrected. He perceived himself as being crucified, and now he moved beyond that. And I only saw him, it was like 4 or 5 times. And that tiny intervention of just accepting his perception of being crucified and moving beyond that in really an ambiguous way, a positive way, an accepting way, it facilitated him moving beyond that. So it wasn't a reframing. It wasn't searching for his strengths. It was joining him in his vision that had trapped him, and just noticing that, well, here you are, here and now, and gave him a line that was congruent with the image that he provided.
Fascinating.
It was a really interesting case. And when I eventually referred him back to the EMDR, referring source, she's like, wow, I don't know how you got him to go beyond that. What was the reality of his view of being trapped in the, being crucified all that time? And I was like, I don't know. I don't know whether that was real or imagined. I don't know whether he was actually hung out to dry. I don't know whether he was in there for 20 hours or whatever. I don't know. But in working with that individual, my hope was to move him beyond that, to get him past being stuck.
Well done. I mean, there is, when you consider the concept of utilization, I think that you hit the nail on the head. It's you join in with the person, that you're not doing it to them, so you're not, taking something and, and making it your own, and then, doing something to them, giving them, guidance. It's that when you're joining in a story like that, and you can't help but join in compelling stories, it naturally takes you to the next step. And in this case, it was with this framework of crucifixion, and you asked yourself the natural question, well, what happens after crucifixion? And then, if it's Jesus Christ, then there's resurrection. And so, there is a logic to it and a sweetness to it. And it's not something that you can predetermine to do. It's a real in the moment. And that to me is what utilization is. And it brings me also to another way that I look at emotions. Emotions are not good, emotions are not bad, they're just information. So I don't look at emotions as this is a positive emotion, this is a negative emotion. I just look at it as, well, it's an emotion, and and what's happening right now. So I think that this is a very interesting subject, that we're talking about what is utilization, and also a little bit about what is pathology.
Yeah.
And generally speaking, with pathology, there's a diagnosis that goes with it. I only diagnose if it's for the purposes of insurance. Other than that, I don't bother with it. And when I create a diagnosis with the client, I go with what's a true diagnosis, but I have it to be in agreement with that particular client. Of this is what I see, da 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 da. What do you think? Is this acceptable to you as a diagnosis? So it's a joining in. It's not me doing it to you. And I think this is an element of Erickson, of your dad, Roxy, that he could fly both ways, where he really felt like he knew exactly what to do, and he would be guiding the situation. But when he was with utilization, it really was a joining in. It's a fantastic orientation. I mean, I even hesitate to call it a technique. That it really is an orientation of what's right in front of you right now in this present moment. And when they manifest it again, if you've seen it a couple of times, but you weren't quite sure what it is or what to do with it, but now you're seeing that it's a pattern, then it's easier to utilize that. And when you're surprised, and when the client is surprised, what a wonderful discovery that is.
So it's actually a totally different look at the pathology, where the pathology is not a pathology anymore, right? It's a set of skills and possibilities.
Well, I tend to define pathology for my own purposes as behaviors that interfere with quality of life. And typically when someone seeks help from a psychotherapist, there is some area that is interfering, some thoughts, feelings, behaviors, or whatever, that is interfering with them living life with the quality that they want. And so that, in my own mind, anything that is interfering with their life has to be examined. Is this pathological? Now, it may be within normal limits, but then that may require a closer look. Like, I have a patient come in and says, "Oh, I have a tendency to be depressed. I have seasonal depression." And and then getting to explore that a little deeper in my own mind. If I'm thinking, well, everything that's being described is within normal limits. And sometimes just offering the opinion or viewpoint that what you're telling me is actually within the parameters of the general population of what's considered normal. And then looking a little closer, but you're seeking help for this. And in my mind, that is, it's worthy of attention. It may not actually be pathological, but it's where the client wants to work. And on the other hand, they may come in with some really distinctly outside of normal limits, as we commented, stating there Buddha or Jesus or some other figure from history. Well, that actually falls outside the parameters of what's considered normal limits, but accepting that and going forward, the key is letting the client's needs and drive where the relationship is going. And again, it's joining into their worldview and moving in, reaching an agreement as to where we're intending to go from here.
I would like to propose a controversial theory, and I'm curious about what you're gonna say, what the two of you are gonna say about that. I say, and it's my idea, that because with the utilization approach, the idea of a resource is connected. So we're utilizing the resources of people. So we can see the pathological, say pathological patterns of behavior or whatever, difficult patterns of behavior as a resource for utilization, which means that they can help the client to achieve their goals. But my theory is that the responsibility for a change in this process is upon a client, but the decision if something is a resource or not, it's the responsibility for that lies upon the therapist. And I'm gonna tell you why I think that. Because obviously the resources are within the client, so the utilization of the resource is the response of the client, and the change process is something that the client is mostly responsible for. And Dr. Erickson actually describes that in your favorite paper, Dr. Catherine Rossi, the burden of effective psychotherapy. But if the client knew what are their resources, they will not need psychotherapy. And I think that the difference in the strategic, say, Ericksonian therapy between good therapists and some like below average therapists lies within their ability to see resources within their clients. Because if client would know where they have the resources and how to utilize them, they will not need the therapy. And so the responsibility of the client is to do the change and take responsibility for the process of change, but the responsibility of the therapist is actually to notice the resources that are there to be utilized. And that's the novel, say, point of view that the therapist introduces into the therapeutic relationship and the whole situation. That's my idea, and I'm just curious what you're gonna say about that.
Well, I think that it is true that that as therapists, we learn to see with different eyes, we learn to hear with different ears, and that we have a whole background of our own personal learnings and our learnings from the books and the professors and supervision and all of that. And so we have eyes and ears to see differently and to hear differently. And so that's one of the things that we bring to the mix with the client. And often a simple rephrasing of something, as really, you didn't quite do a reframe with the man, who was crucified in his own mind on the machine, but you brought out a different perspective. And that what this is also part and parcel of what's so much of what Erickson taught, is that you give a variety of possibilities. And when you think about the prepositions of all the places that you can go, and that when you're with someone and so you're thinking of all kinds of possibilities in that way, and gently you try them out. And then when you get a response from the person, their eyebrows lift, their eyes open up more, then you get some sort of physical response, you know that, oh, well, it might be in that particular direction. So a controversial thing that I will do, and I don't know how I get away with what I get away with, but I always have, is that if someone is really saying something crazy, I might even respond, that sounds crazy to me, because it's an honest statement. And this is another element that I'm bringing forward, is this honesty, this being real. And that because in addition to being the person's therapist, in that moment, you're their friend too. And so, if your friend was crazy, you'd say, that's a crazy idea. And so, so it's gentle, it's knowing about timing with these things, and to not have a judgment about it, because that's what they receive in their outer world. It's like, oh, you're crazy, instead of, that sounds crazy to me. So there's a very different way of approaching these things. But yes, I think that we as therapists, that our job really is to have this broader perspective, to not have a one size fits all of how you approach things. And to me, that's the heart of utilization.
Well, I just want to add on that. And for the most part, I fully agree with what you're saying, but I approach it from a little different perspective. What I say to my clients is that I'm here with my talents and you're here with your talents. And we've come together to explore what your needs are. And my job is to give you objective feedback about whatever it is that your job is to be fully honest with me. And my job is to reflect back to you what this looks like to me. And like you, I say, God, that sounds totally crazy. Or that sounds, unlikely that you're going to achieve what you're hoping to achieve. So I do give this really honest feedback. But it's not always as extreme as that. I can have somebody come into the office and they say, well, I clean, I'm really OCD, I clean compulsively. And then I can ask them, well, and what do you hope to, what do you hope to do with that? So I'll let them identify what they want to do. And if they say, well, I just want to reduce the number of hours a day that I'm spending on her, or something like that, well, yeah, we can work with that. But if they're, then I will point out that, gosh, for example, I had one office mate who was really a compulsive cleaner. And I just celebrated her. Ray, I know I couldn't trust you to vacuum the floor every day. How lucky I am. So I've reframed the relationship with worrying about is this pathological, to reframe it as a strength. But the utilizing the client's perspective, where are we going to go? Where do you want to go? Is this achievable? But most important, and you didn't even mention this, Catherine, but I know that it is central in it, is utilizing the moment when the subject, when the client, when the patient is ready to be receptive to what other ideas and possibilities we have to offer.
Absolutely. And Ernest and I wrote a book called The Symptom Path to Enlightenment, which is another element with this. And the symptoms don't have to be pathological, for instance. But and one of the terms for it was the merry symptom chase. So, it was like a physical symptom. It's like, well, I really feel this pain in my head. I have a headache. It's like, okay, then let's see. Just see what happens with that. See if it moves anyplace else, or if it continues to stay right there. And then they tune in sensitively to it. Well, doctor, it's kind of like move from here, and now it's up on the top of my head. It's like, wonderful. Because what we know is if the symptom can move, it can move out. And so then we follow the symptom of where it wants to go next and next and next and next, basically until it's either comfortable or it isn't there anymore. And so that's another form of utilization. And taking what's really troubling a person, and you can I'm just talking about that with physical symptoms, but sometimes with a mental perspective on something that where a person is they're in pain, they hear the same iteration on the inside of themselves, of their whirling mind, and the method is really the same. It's like, okay, so on a scale of 1 to 10, how painful is that for you? Oh, well, doctor, it's a 7. It's like, wonderful. Can you make it an 8? Well, I don't know. I said, just tune in and see if you can make it an 8. Yeah, it's an 8. Great. Do you think you can make it a little bit more? Same thing. What comes up is going to come down. So it brings in an element that I really treasure, of facing your fear so the fear can leave, facing the pain so the pain can leave. You do nothing, nothing happens. And so I think it's another element of utilization. It's another element of following the problem, whether it's within the normal limits or if it's pathological. It's just another technique.
Another tool, another way of looking at things, and all within the framework of utilization. Okay, so I'm thinking about, do I have any more questions? I'm thinking about, the fact that we could do the whole series about utilizing different things and utilizing the same things in different, to different problems or challenges. When you were talking previously about the guy who was thinking, who thought that he was Jesus Christ, I was thinking, let's do the whole podcast about how to utilize things in in problems like schizophrenia or psychosis in general. That would be something interesting, And then I thought, and also this and that and that. So, maybe we're gonna create the whole series about that and be more specific towards different kind of problems. What do you think about that?
Oh, I think that as people respond to this podcast of what their interests are, that that would lead us further in that direction, which is another example, of course, of utilization. But the idea of being in the moment and receiving what it is that's in front of you in a non-judgmental format, and then seeing it, gently testing if the direction that comes to you as a therapist is a direction that's going to be helpful. And also remembering is that Erickson, if he could see that whatever direction he was going in was not fruitful or not the right one, he would stop mid-syllable. He wouldn't finish the word. He wouldn't finish the sentence. And so, in having this flexibility, because it takes courage to involve yourself in utilization, that it's an ego-free kind of situation, because you really don't know if it's going to be effective or not. You're experimenting, a thought experiment, or physical experiment, or whatever it is. And so the joy of helping the client to appreciate experimentation, and that you as a therapist, you want the best for them. You want them to be able to, whatever their goals and whatever their desires are, you really want that for them, and they know it. And so then you make a test to say, well, let's try this, or let's try that, or within the very really gentle ways we've been talking about utilization. And I can't help, because I love these stories. The peak in Phoenix is called Pistawa at this particular point in time, but in the day it was called Squaw Peak. And then they actually named the woman, but of how often Erickson would send clients up to climb, walk up Squaw Peak. And for anyone who's never been there, let me tell you, it's a challenge. This is not just a little walk in the park. You're walking up a mountain and back. You got to be in some kind of physical shape to do it. It takes a lot of stamina. And but to be able to sometimes make the experiment to see if the person actually has the resolve on the inside of themselves to face whatever problems they need to face. And so there's just, it's kind of endless of with utilization. And really in reading the works of Erickson, that the collected works, full disclosure, Roxy and I are editors of the collected works of Milton Erickson, and we're getting them out in digital form. And so you can get about half a dozen of them right now on Amazon, as ebooks and whatnot. And you can also get the actual book printed whatever country that you're in, it's in English. But in reading his cases and seeing the innovative ways that he did this in thousands of different ways, we barely scratch the surface with this. And what it takes is that someone that's inspiring you so that you can reach into the depths of yourself and make the experimentation with utilization, whether it's utilizing the person's best qualities, or whether it's utilizing the worst qualities that they have. It's really whatever is predominant in front of you at the time, I believe, is how you choose. And lastly, I'll say, because this is something that Ernest just instilled in me, is that on one hand, you have, let's just call it the problem. And by way of contrast, what you have on the other hand. So we've been just speaking almost in a one way of, with the utilization aspect of it. But when a person is dealing with something that's really difficult, that it is vitally important to have something positive in the other hand by way of contrast. But the client, decides what's positive in the other hand. You as the therapist, you are missing out if you tell them what's positive in the other hand.
Yeah. But on the other hand, as a therapist, you are setting up the situation where they can do it.
Yes.
You are setting up an opportunity, but it's the client that responds. It's for example, with that fellow that tells me the scenario of being crucified, and when I responded, oh, and now you've resurrected and here today, I was taking a risk, and I did. I wasn't sure whether this was a full-blown psychosis or whether this was just almost a pathological psychotic moment, circumstantial to his life history. And I didn't know how he was going to respond to that risk I took to express myself in that way. I had to be ready to roll with his response, which turned it out to be as positive as I could possibly have hoped for. But sometimes it doesn't always go that smooth. And as Catherine pointed out, the professional needs to be able to assess where we're going with this. Are we going in a healthy problem-solving direction? Or is this going off the rail? And if it's going off the rail, there needs to be some professional judgment as to whether this is a good utilization of the time allowed. And one of the redirections, with clients as you're working in an ordinary private practice, is to point out, we've been talking about this for 15 minutes. We have a half an hour left. How are we going to use the remaining time that we have today to best position you to advance in the direction you would like to go? And that's a totally open-ended, genuine question that again puts the burden of responsibility on the client. It's merely an open statement of this is where I'm observing, this is where we're at. And, it's your choice where we go next. But again, when you have enough clinical experience to be able to size that up and call attention to how things are progressing, that enhances the trust, it enhances the rapport. It's an expression of honesty, and it deepens the cooperative work between the therapist and the client.
Well, I think that's a great summary of everything here. I don't have anything to add to this. So,
Well, it's been wonderful today, and we sure look forward to next time.
exactly. So, thank you very much for today's podcast, and have a wonderful evening, day, or morning, whenever you are. And see you next time in another episode of our endeavor together.
Thank you.
Bye.
This was another episode of our Experiencing Consciousness podcast. Thank you for being with us.
Thank you, Jan. You're the best. Be well, be happy, celebrate life.